COVID, pregnancy, it's insane. I just can't even. Hello everyone and welcome back to my channel. This week we're going to be talking about Ireland, COVID, birthing, pregnancy, all the drama. It's insane. So we're going to be talking all about that. If you don't know, basically there's just uproar at the moment because, as rightly so, and I'm very passionate about this, because basically women and people who are pregnant are being forced to give birth on their own, and it's just insane. And we're gonna get into it in this video as to why it's so insane, and hopefully something will change. I don't know, but this is just my 2 cents towards it. So we're going to talk about what's the story, what are the rules, why it's ridiculous that, you know, people have to give birth on their own, and scans and everything, and what you can do to help or do something, or what we can all do. 2 disclaimers. 1, I have never given birth or been pregnant, so I have absolutely no idea what these people must be going through, but from what I've seen, it's horrific, so I just wanted to say that. 2, things are changing literally every single day, so this is just the information that I have right now. That's the most up to date, but this could all be different again tomorrow, so yeah, just take that with a pinch of salt, what you will, whatever, and yeah, just keep up to date on the subject, and just educate yourself and just see what's going on, because it's just insane. So let's jump right in. Yeah, so basically, if you haven't already gotten the gist from the first few minutes of this video, basically, yeah, like, women are having to give birth on their own, partners are having to leave straight after the baby is born, if they're even allowed in the first place. It's insane. People are having to go to like scans and tests and everything on their own. Like it's just so scary. Like, if it could be your first baby, you don't have a clue, there could be something wrong. Like, you need your support system there, and it's just insane. And basically, like, why people are just freaking out is just like, there just doesn't seem to be any talk on it. It doesn't seem to be on the government's radar. It just doesn't seem to be this issue, but it is such a big issue, and it's just like, okay, it's kind of just mind-blowing, because it's like, this is a huge issue. Why is no one talking about this? What's going on? So in terms of the actual rules, I have it here. It says on the HSE website, it says, appointments and scans, semicolon, you should go to these visits or scans on your own to reduce the number of people in the hospital. And like, logically, yes, we can understand all of this. It all makes logical, to a degree, sense. During birth and labour, semicolon, in most cases your partner can be there for the delivery. Every effort will be made to ensure your partner is present at the birth, but in some hospitals this may not be possible. Any restrictions in place are to keep everyone safe. And then it's like, after the baby, semicolon, visitors in hospital, semicolon. All maternity units have a strict no visitor policy. I don't know, it just says that at the end. So that's on the official HSE website, but there's basically just been like random bits of information. And yeah, totally, we're in a pandemic, no one knows what's going on, and there's been random bits of information coming from like news outlets and different things like that. So from the Irish Times on the 20th of September, it said they're trying to introduce virtual visits, and every maternity service will be asked to review rules weekly. So it's a totally ever-changing thing. The virtual visits thing, I'm like, are people already not there? Literally in the article it says like, oh, women will take out their phones and be on video chat to their partners. It's like, that's the best you can come up with, is it? They probably were already doing that, but okay, like, revolutionary. Then another one was that, and I have it written here, Taoiseach Micheál Martin told the Dáil that guidelines are currently being drafted by Dr. Peter McKenna, and he's basically the master of the Rotunda Hospital in Dublin, clinical director for the National Women and Infants Health Programme. He's also a man, which is worth mentioning, I personally think. Why are you whatever. Basically, he said that, yeah, guidelines are being drafted by Dr. McKenna, but that he could not promise that pregnant women and their partners would be treated the same in all maternity hospitals, even when the guidelines are published. So it's like, yeah, they, at some point in time, they may publish guidelines for it, but that even when they are published, like, every hospital is different because of like size, capacity, I guess, I don't know, the amount of like entrances and exits and amount of staff and everything is so different. So yeah, it's just like, okay, well, even if our guidelines are published, is there going to be still like you're just not going to know, you know? It's going to be literally a case by case basis, and it's just like, I just can't, I honestly just can't even imagine, because like you're already having a baby, you're already so unsure of what's going on. And that's even if it's a completely healthy baby. Like what if your baby has an issue? Like it's just, I just can't even imagine. And then not even knowing if your partner can come with you while you're in labor, while you're giving birth, if you're having a C-section, like to the scans and the appointments. Again, if something is wrong with your baby, I mean, how, I just can't even fathom. Like it's just, oh my God, just the stress. I just can't even. So that's basically like an overview of, I guess, the situation right now. I said it's always changing, and that's not even like a good like overview, because there literally isn't any like official guidelines. Like that's literally what we have to work with. It's just insane. And basically I think like one of the reasons why it's getting such traction, which I wanted to mention in the video, was the In Her Shoes pregnancy during COVID Facebook page, which I'll link below. Stories, and again, it's like with anything, it's like with the repeal referendum, everything, like personal stories just tell a story, and the stories of what women are going through during COVID and giving birth are insane. So if you take anything from this video, please go read that page and read some of the stories, and you'll get a sense of how this actually impacts the women. Because like, I know, and it could be so easy for me as someone who hasn't given birth or hasn't been pregnant or whatever, to be like, oh, but you're like, you know, just do it alone, it's grand, like you'll see your partner, whatever. But it's like, sometimes people aren't seeing their partners for days afterwards. Even if the partner is there for birth, they have to go home alone without their kid. Like it's not just like the women it's affecting, it's the men as well. It's just insane. Like the personal stories are just awful. Like if people are having complications, they're taken away from their babies. It's just, I can't even do it justice, but go read the page, and yeah, just read some of them, and you'll even get a flavour for what the stories, even after like 2 or 3 stories. And now basically I kind of just want to give a few reasons as to why it's insane. I probably already have gotten that across, hopefully, but there are just some like legitimate, just factual reasons why this is just insane, and just why it hasn't been addressed properly is just so insulting. And I am coming at this from a feminist point of view. I just think it's outrageously sexist. Like of course, you know, women's issues are not being treated with the seriousness and like gravity they deserve in the middle of a global pandemic. Of course they're not. You know, that's where I'm at with this. So it's just ridiculous. So let's go through some of the things. So just in terms of like literal numbers, for anyone who might say like, oh, but you're like, how many babies are really being born in the middle of a pandemic? Like, how, you know, how is this that big of an issue compared to like the rest of the population? Well, I'm glad you asked. Approximately 30,000 babies have been born in Ireland since the start of the pandemic. 30,000 babies. And all going well, that's more than likely 60,000 parents. 60,000 people. So that's 60,000 grown-up humans, and then 30,000 new babies. That's 90,000 humans. That's not nothing. That's not like a small issue that just no one cares about. That's a big deal. So that's just to give you a sense of what's going on. 30,000 babies. Would you have thought? But there we are. Secondly, what grinds my gears is, and again, if you're in Ireland, you'll know, literally all the news has talked about over the last few weeks is the pubs. The pubs. And I 100%, I'm getting so emotional. This is so funny. I hear the pub owners awful. I mean, their businesses have just been completely closed for months. I hear you 100%. And it's not to take away from that issue, but it's like, again, why is there so much focus on pubs and drinking and not on women giving birth to the future of this country? And just, I'm just so embarrassed for my soul that I even have to try and distinguish the two from each other, because it should be so glaringly obvious that like you getting your pint on a Saturday night is very different to a woman giving birth to a human. I hope that's very clear for everyone why it's insane that the pubs have gotten so much airtime and this has gotten like minuscule amount of airtime. Like it's insane. So that's just what really annoys me. What also just baffles me is like so many of the times in the hospital, like you hear the stories that like the man is allowed in, the father is, or the partner or whatever, is allowed in at the 11th hour. And I'm just like, and again, totally respect hospitals and everything they're doing, and I'm not a doctor and blah blah blah, but it's like, if you can let them in, if you're going to let them in at all, why not let them there for the whole thing? Like, I just don't know, like, either don't let them in at all or allow them be there for the whole thing. Like, yeah, wear PPE, stay in the room, like, don't be, like, it's just like you're gonna have to interact with your wife, who you live with. So if she has corona, and if one of you has corona, the other person probably has corona. So like, it's not like you're inviting in this random person, but like, you're gonna interact with all the medical staff anyway during the birth or whenever you're allowed in. So why not be allowed in for the whole thing? It's just I would much rather it be, okay, not allowed in at all or allowed in completely. Like, that's what makes sense to me. But I'm just like, if you're gonna let them in, why not let them in for the whole thing? It's just insane. And again, it's just like, you're allowing him in at the 11th hour, and it just feels like you're letting him in so that he can see his baby being born. But it's like you're putting his need, like you're taking into account his need. And it's like, well, what about her need to have a support system with her? Like, she's alone now, and you can be in labor for hours. She's alone now going through all of this. What about her need to have someone there for that whole time? But by allowing him in at the last minute, you're taking into account his need. But it's like, what about her need? What's going on there? What are the thought processes there? I don't know. What's also, again, just ridiculous, which I briefly kind of mentioned, is just that, like, on any of like the major guidelines, like the big sheets that we've all seen with like all different categories, like sports, entertainment, restaurants, everything, it's not even a category. It's not even a category. I'm just like, how is it not a category? How is it not being mentioned? It's just quite, again, insane. It's quite like, okay, are we pretending like this isn't happening? Like, we're shoving this under the rug? Is that the vibe? It's really weird. It's just like, address it. Just address it. And like, yeah, it has been talked about, you know, a couple times in press conferences and stuff, but it's just like, are you planning on doing something? What's happening? I don't know. Then what's even just really brings it home how ridiculous and laughable the whole thing is that the World Health Organization has like specifically stated, and again I'll link below to their website, I quote, "All women have the right to a safe and positive childbirth experience, whether or not they have a confirmed COVID-19 infection." So even if you have COVID or not, like yourself, the birthing person, you have a literal human right to a positive birth experience. And then, again, laughable, it literally says you are allowed to have, quote, a companion of choice, unquote. Like, you are like literally, the World Health Organization, who are like the go-to people on COVID, everything, are literally saying, again, it's just like, it's just so classic Ireland not to be following like international guidelines or law or just like human rights standards on things. It's so funny, and particularly with regards to women's health. It's just so not shocking at all. But it's just like, the WHO are saying it's fine. Here you go. Here's a companion of choice. It's all you're asking for. And yeah, and just, you know, finally on why it's so ridiculous. It's like, you know, no woman is asking to be bringing their dog in, their nieces and nephews, their grandparents in. Like, nobody's asking that. They just want one person who they know, who they're familiar with, like potentially the father or the other parent, like who also should be there for the birth of their child. It's just insane. Like, that's all they're asking for. And it's like, it's not even like we're coming at it from this angle of like, oh, lockdown is ridiculous, the virus is a pandemic, and Corona is a hoax. It's not that, and it's not that, like, even I'm not opposed to lockdowns or anything, but it's just like, it's just a bit of compassion. And again, it's just the complete disregard for women's health and well-being in this country is insane, and the track record is not good. And so it's just like, you know, it could totally be, yeah, maybe just a simple oversight, but it's just like, with the history, I don't think it is. And it's ridiculous, and it needs to be changed. Something needs to be done. And honestly, I really encourage you to read the Facebook page and just to get a sense of how honestly traumatizing it is for people. So yeah, that's me and why it's ridiculous. So yeah, basically, I mean, like, what can we do? I don't know. I'm here making this video. That's what I'm doing. You can email your politicians, email your TDs, senators in your area, ask them for clarification on the guidelines, put a bit of pressure on. Email hospitals, get their official statement on what their guidelines are. As said, it's literally different everywhere, so it's just like what is going on, and I just think it's the unknown, and it just must be awful. And again, I'm here making this video and I'm so passionate, but I don't even have the first idea of what it must be like to go through that. Awful. So yeah, that is this week's video. I'll leave loads of links down below to different news bits and different resources, like I said. Hope you enjoyed the video. Please give the video a thumbs up if you enjoyed it, and subscribe to my channel if you want to see more videos like this. It's insane. Let's do something about it, and let's just try and raise awareness, and yeah, maybe something will be done about it eventually. So yeah, thank you so much for watching, and I will see you all in next week's video. Bye!